This is Dr. Sudha, and today I welcome you all to a new video which is based on your Unit 4 content of your AECC1 Environment Study and Disaster Management. So as you all know that it is one compulsory paper for all the +3 first semester students, and I have already completed up to Unit 3 totally as per your syllabus. So if you have not watched my videos till yet, then please go to my playlist and watch all the videos, and you will also get important 1 mark questions, previous year questions in my channel. So the name of my channel is your Environ World for Students by Dr. Sudha. So you can search every content in my channel. So today we will discuss, it is our 7th class of Unit 4, and in this video we will particularly discuss about the details on flu and tuberculosis, that you know as TB. Okay, so we are discussing about different types of communicable and non-communicable diseases. So as you all know that tuberculosis is one communicable disease, and it is spreads through the viruses through air. Okay, so without any further delay, let us discuss about this class. So before going to the discussion, I would definitely like to request you, please subscribe my channel if you have not subscribed it till yet, and if you are new to my channel, then please subscribe, and if you are watching my channel but till yet not subscribed, then also I will request you to please subscribe and share among your friends, so that I will get some motivation. Okay, so if you will watch this video from first to till end, then you will be able to learn about the details regarding your flu, tuberculosis. Okay, so the WHO definition regarding the influenza or flu, then your its symptoms, then period of contagiousness, then flu risk factor, then H1N1 flu are of different types. So we will discuss about different types of flu like H1N1 flu, avian flu, okay, then variant flu. Okay, so then we will discuss about tuberculosis, that is its definition, then what are the causative organisms, then the portion affecting TB in different continents, then your then we will see severe symptoms, then how TB spread, then types of TB, okay, then how TB is diagnosed, and how we can prevent the TB. Okay, so these are the total discussion of today's class. So request you all to please watch till the end. Okay, so now let us discuss what is influenza or what is flu. So look, you all have acquainted with WHO, means World Health Organization, during the COVID pandemic period. Okay, so WHO defines influenza or flu. Okay, so WHO defines flu or influenza as a viral infection that affects mainly the nose, throat, bronchi, and occasionally lungs. Okay, so where it affects mainly nose, throat, bronchi, and occasionally to the lungs. Okay, then infection usually lasts for about a week. If you will be affected by flu or influenza, then it will remain with you for about a week, minimum about a week, and is characterized by sudden onset of high fever. Sometimes you will be, or some symptoms will appear like high fever, then muscle ache, then headache and severe malaise, then non-productive cough, sore throat, like, okay, it is. So these are the symptoms and definition of your influenza or flu. So flu, or that we call as influenza, is an infection of the nose, throat and lungs, which are part of the respiratory system. Because you know that in human being or inside us, the respiratory system contains, or it covers your lung, then throat. Okay, so it when you will be affected by flu, then all these respiratory system will be infected. So influenza is commonly called the flu, but it's not the same as stomach flu viruses that cause diarrhea and vomiting. So most people with the flu get better on their own, but sometimes influenza and its complications can be deadly. So if someone will be affected by flu, then it will be cured automatically with that person, affected person. But sometimes it may be fatal, or it can be deadly. So people at a higher risk of developing flu complications include young children under age 2. They are more vulnerable, and when they are affected by flu, it creates complication. Then adults older than 65 years age. Then residents of nursing homes and other long-term care facilities. Then people who are pregnant or plan to be pregnant during flu season. Then people with weakened immune system. American Indians or Alaska natives, they are also very common towards the infection of flu. Then people who have chronic illness such as asthma, then your heart disease, then kidney disease, liver disease and diabetes, they are very much prone towards the infection of your diseases, okay, or your influenza or flu. So people with a body mass index of 40 or higher also have a risk of infection by flu or influenza. So what are the symptoms? Now let us see. So at first, the flu may seem like a common cold, as we generally infected by common cold with a runny nose, sneezing and sore throat, and colds usually develop slowly, but the flu tends to come on suddenly. And while a cold can be miserable, you usually feel much worse with the flu. And what are the common symptoms? Like your fever, then aching muscles, then chills and sweats, then headache, dry persistent cough, then shortness of breath, then tiredness and weakness, runny or stuffy nose, then sore throat, eye pain, vomiting and diarrhea. But this is more common in children than adults. Okay. So what is the period of contagiousness? So you may be able to spread flu to someone else before you know you are sick, as well as when you are sick with symptoms. So people with flu are most contagious in the first 3-4 days after their illness begins. Okay, means in the primary stage, the people, they are most contagious, means it is transferable, or it will communicate to one healthy person within the earlier stages of infection. Okay, so some otherwise healthy adults may be able to infect others beginning 1 day before symptoms develop and up to 5 to 7 days after becoming sick. Okay, so some people, especially young children and people with weakened immune system, might be able to infect others for an even longer time. Okay. Then what are the risk factor of flu? So influenza is a very serious illness for anyone at high risk. And certain diseases that place people at high risk include your chronic lung disease such as asthma, then bronchitis, then cystic fibrosis. Okay. Then heart disease, it is also one common risk factor. If you have heart diseases, then there is every chance of attack by flu or influenza. Okay. Then chronic kidney disease, then diabetes or other chronic metabolic disorder, then morbid obesity, severe anemia, then diseases like your HIV AIDS or treatment like steroids, chemotherapy, that's suppress your immunity power. Okay. Then liver disorders, children and adolescents who are receiving long term aspirin therapy, these are risk factors. So there are different types of flu like H1N1 flu. So H1N1 flu also termed as swine flu. Okay. It is caused by H1N1 virus back in 2009, if you can remember the year of 2009. During a worldwide outburst was declared as pandemic by WHO, and it is one of the different types of flu and is considered serious. And however, now with the discovery of vaccine and flu shots, it can be prevented with vaccines and treated with medicine, and it is an airborne infection and spreads by coming in contact with an infected person or its droplets. Okay. And if left untreated, H1N1 flu may get worse and may also develop pneumonia. Okay. Breathing problems and lung infection. Then come to avian flu. So avian flu is caused by a virus called as H5N1 virus. On getting infected with H5N1 virus, a patient shall experience difficulty in breathing, then cough and high fever, and the statistics reveal that around 60% of the individuals found infected with avian flu died. As the name suggests, avian flu spreads from birds to human beings, because AV means AV are nothing but birds. Okay. So the most common source is chicken. So avian flu symptoms are, the symptom or it varies or differ from person to person. However, the most common symptoms include high fever, difficulty in respiration, then cough along with diarrhea, then severe headache, sore throat, body and muscle ache, and running nose. Okay. Then variant flu. Variant flu is caused by H3N2B virus, which is also called as a variant virus. As compared to other different flu types, its symptoms are not life-threatening. However, complications may develop, and if left untreated, the variant virus is present in pigs, and the human may get infected with the virus when the sneeze or droplet of the pig land in human's mouth. Okay. So generally variant flu, it comes from the pigs. So this type of flu is generally seen in children, as adults are immune to the H3N2 virus. Okay. So what are the symptoms? So the common symptoms of this flu is your fever, body and muscle ache, chills, then cough, sore throat, fatigue. Okay, as these are the commonest symptoms of variant flu, and since it normally happens in children, therefore it is advised to rush to a pediatrician as soon as you witness any of these symptoms. Okay. So the only proven method for preventing influenza is a yearly vaccination. So the method to prevent your influenza is your vaccination approximately 2 weeks before the flu season begins. Okay, so generally there is one season when flu begins. So before that beginning of the flu, you have to take proper vaccination. Okay, so since the influenza virus is subject to genetic mutations with the avian or NA protein, new vaccines that consist of different influenza strains need to be developed each year. Then vaccine is trivalent, meaning that it provides resistance to 3 strains of influenza. Okay, and the vaccine consists of 2 influenza A virus pathogens and 1 influenza B pathogen. And the protective value of the vaccine varies between 70 to 90%, and immunity lasts for only 3 to 6 months. Okay, and revaccination on an annual basis is recommended. And the killed vaccine can produce fever, local inflammation at the site of injection, and very rarely Guillain-Barré syndrome. Okay, and since the vaccine strains are grown in eggs, persons allergic to eggs may develop the symptoms and signs of hypersensitivity. Okay, and most influenza vaccination programs make use of inactivated vaccines and subcutaneous route. Subcutaneous means cutaneous means through your skin, so subcutaneous means inside your skin. A single inoculation, that is 0.5 ml, is usually given. However, in persons with no previous immunological experience, 2 doses of the vaccine separated by an interval of 3 to 4 weeks are considered necessary to induce satisfactory antibody level. Okay, so now let us discuss about the tuberculosis. So as you all know that it is abbreviated by TB. Okay, so TB, that is tuberculosis, and it is a potentially fatal contagious disease that can affect almost any part of the body, but is mainly an infection of the lungs. And in Neo-Latin words, tubercle means round nodule or swelling, and osis means condition. Okay, then what are the causative organisms? That is caused due to Mycobacterium tuberculosis, and it enters to the human body, and that is by Mycobacterium bovis, and it goes to animals. Then in 2011, there are an estimated 8.7 million incidence cases of TB globally, and it's equivalent to 125 cases in 1 lakh population. So if we will see the data in different continents, then we will find that in ASEAN 59% of population is affected by your TB, and in Africa 26%, Eastern Mediterranean region 7.7%, European region 4.3%, region of the America 3%. Okay, and India is the highest TB burden country, accounting for more than 1/5 of the global incidence, and in Philippines 3%, Pakistan 3%, Ethiopia 3%. Okay, you can see the entire data of people percentage affected with TB in different countries. So see here, it is the data for India, which is maximum, that is 21%. Next to this, then your China 14%, and another is here other countries, that is 20%. Okay, and so basically India people are much more affected by TB. Then look how TB is spread. So coughing without covering the mouth. This person is coughing and spitting So he has not covered his mouth, hence the droplets coming from his mouth and it moves through the air, and crowded places with poor ventilation also the spitting or the droplets coming from their mouth, it is moving inside the room, and when some healthy person will come in contact with that, then that person will also be affected by this TB, because it is one airborne disease. Okay, so if some person, infected person will spit everywhere, then through its spitting or through its droplets, this will spread to healthy persons also. So these severe symptoms of this tuberculosis is persistent cough, chest pain, coughing with bloody sputum, then shortness of breath, urine discoloration, cloudy and reddish urine, fever with chills, then fatigue. These are the common and severe symptoms arise due to tuberculosis. Then let us look to the types of tuberculosis. So one is your pulmonary TB, then another is your extrapulmonary TB, then your TB of upper airways, then genitourinary TB, then your skeletal TB, then gastrointestinal TB, then your TB meningitis and tuberculoma, then TB pericarditis, then military or disseminated TB, then your less common extrapulmonary TB. These are the 10 different varieties of TB that is commonly found in our country or in global wise. So pulmonary TB is again divided into primary tuberculosis and secondary tuberculosis. So primary tuberculosis is nothing but the infection of an individual who has not been previously infected or immunized is called primary tuberculosis, or Gohan's complex or childhood tuberculosis. Lesions forming after infection is peripheral and accompanied by HELR, which may not be detected on chest radiography. Okay, then second is your secondary tuberculosis, the infection that individual who has been previously infected or sensitized is called secondary or post-primary or reinfection or chronic tuberculosis. Okay, then let us discuss extrapulmonary TB. That is your, it is again of two types. So 20% of patients of TB are affected by extrapulmonary TB. So that those are of two types. One is lymph node TB, that is tuberculosis, lymphadenitis and pleural TB. Okay, so symptoms are your painless swelling of lymph nodes, most commonly at the cervical and supraclavical scrofula. Then systemic systems are limited to HIV infected patients. Then involvement of pleura is common in primary TB and results from penetration of tubercle bacilli into pleural space. Okay, then your TB of upper airways means involvement of larynx, pharynx and epiglottis, and symptoms are dysphagia, chronic productive cough. Then genitourinary TB, that is 15% of all extrapulmonary cases. Any part of the genitourinary tract get infected. Then symptoms are urinary frequency, then dysuria, hematuria. Okay, these are the symptoms. And skeletal TB, involvement of weight bearing parts like spine, hip, knee. Then symptoms are pain in hip joints, then knees, swelling of knees, trauma. Then gastrointestinal TB, involvement of any part of GI tract. Symptoms are abdominal pain, diarrhea, weight loss. Then your TB meningitis and tuberculoma, that is 5% of all extrapulmonary TB results from hematogenous spread of 1 degree and 2 degree TB. And next type is your TB pericarditis. 1 to 8% of all extrapulmonary TB cases and spread mainly in mediastinal or hilar nodes or from lungs. Okay. So these are the types of tuberculosis. So now the important thing is how we will diagnose the TB. So there are bacteriological test, sputum culture test, radiography, then nucleic acid amplification, then tuberculin skin test. Okay, these are the 5 methods to diagnose the TB. So first one is bacteriological test, means that is the name is Jehel-Nielsen stain and Oramine stain, that is fluorescence microscopy. Okay, then second is your sputum culture test, that is low intestine Jensen sodium solid medium 4 to 18 weeks, then liquid medium 8 to 14 days, agar medium 7 to 14 days. Okay, then radiography, that is chest x-ray, then nucleic acid amplification, that is species identification, it takes several hours, and low sensitivity, high cost, most useful for the rapid confirmation of tuberculosis in persons with AFB positive sputa. Okay, then utilities AFB negative pulmonary tuberculosis, then extrapulmonary tuberculosis. Okay, then your tuberculin skin test, that is injection of fluid into the skin of the lower arm. Here you see that injection of fluid into the skin of the lower arm. Then 48 to 72 hours later checked for a reaction, and diagnosis is based on the size of the wheal. Okay, one dose is equal to 0.1 ml, contain 0.04 microgram tuberculin, that is PPD. Then what are the preventive measures? Preventive measures of TB is your mask, then your BCG vaccine, then regular medical follow-up, isolation of patient, ventilation, natural sunlight, UV germicidal irradiation. Okay, then tuberculosis prevention. These are the methods. First important thing is personal hygiene, second is immunization, third is healthy lifestyle and environment. Okay, these are the most important preventive measures from tuberculosis. Okay, and there are different techniques like your BCG vaccine, then your DOTS. These are the treatment processes. Then multi-drug resistant TB, then extensively drug resistant TB. Okay, so BCG vaccine, that is bacil calmette guerin, BCG. Okay, first used in 1921. Only vaccine available today for protecting against tuberculosis, and it is most effective in protecting children from the disease, and given 0.1 ml intradermally, and duration of protection 15 to 20 years, and efficacy 0 to 80%. Okay, then DOTS, directly observed treatment, short course. Then DOT means that a trained healthcare worker or other designated individual provides the prescribed TB drugs and watches the patient swallow every dose. Okay, this is DOTS. This is the sure cure for TB. Okay, so multi-drug resistance TB is TB caused by strains of Mycobacterium tuberculosis, and that are resistant to a least isoniazid and rifampicin, the most effective anti-TB drug, and globally 3.6% are estimated to have MDR-TB, and almost 50% of MDR-TB cases worldwide are estimated to occur in China and India. And extensively drug-resistant TB is a form of TB caused by bacteria that are resistant to ionized and rifampicin as well as any fluoroquinolone and any of the second line anti-TB injectable drugs. Okay. So these were the discussion or content for today's class. So we will meet in our next class with some new content. So till then, bye bye and take care. So before leaving this channel, I would definitely like to request you, the persons who have not subscribed my channel, please subscribe and share among your friends. So my dear students, this channel will help you a lot for preparing yourself in the compulsory paper, that is AECC1 Environment Study and Disaster Management, both for Odia medium and English medium students, because I have prepared different playlist for your better understanding. So today we will remain here. So bye and take care.